Go over the green bag. I call it the green bag. The official name of it, I believe, is the Mapleson bag. This is a flow inflating bag. It can deliver positive pressure ventilation, CPAP, and blow-by, but it does require a gas source. So you can see here it's a half-liter bag. It has a 40 centimeter of water pop-off. You want to leave the cap off because we do want it to pop off at 40. If for some reason you needed to give more than 40, you would cover it up, and then that's like danger, red equals danger, and that would allow it to go into these higher numbers on the manometer. So you want it like this. Here's your manometer. Here is your flow control valve, and this is where you make adjustments to how much flow is going into your bag, and this is how you're going to set your PEEP. Your PIP is set by how much you squeeze your green bag. This is the outlet for the O2 tubing, so we're going to plug it in here. This is an outlet for an additional attachment to hook it up to the manometer on this bed. Now, we don't have, you could use an oxygen tubing if you wanted to do that. You could just grab one of the 7-foot oxygen tubings, hook it up to this, and then hook it up to this manometer outlet right here. But for our purposes today, we're going to use this manometer on the bag itself. So let's go ahead and turn on our flow. We're going to increase to 10. And right now, we see that this is red through the little window, and that tells us that our flow is completely going to our bag. So if we were to occlude, you're going to see it fill up and give us a lot of PEEP. So we got a PEEP of 40 right now. We don't want that, so we're going to open our valve until we see our manometer drop to an appropriate level of PEEP, which for us would be closer to 5. So there's our PEEP of 5. And that's how much our valve is open. But this is going to be dependent on the individual patient and how you set your flow. So once you attach your mask and you're making a seal on the patient's face, you may need to make some minute adjustments in your flow control valve here. But if we were bagging our patient, we have a PEEP of 5. Now we're going to give the bag a squeeze. And you see if we completely let go, it goes back down to 0 first. So what I like to do is give it a squeeze and then leave my fingers slightly indented on the bag. And that gives me a chance to maintain that PEEP level. The advantage of this type of equipment is you're really able to feel the patient's lung compliance. So you'll be able to tell if it takes a lot of effort to get the air in or very little effort. Again, just like the NeoPuff, we're aiming for PIPs 20 for a term infant, 25 for a preterm infant, but also looking for that good bilateral chest movement. And we want to make sure that someone's listening with a stethoscope to ensure they're hearing bilateral breath sounds. If you're just giving CPAP, you will have set your flow control valve to the appropriate PEEP level, and then you're just going to make a seal with your mask. If you're just giving blow-by, you'll be able to just attach the mask, hold that close to the baby's face to deliver blow-by. Once again, we're adjusting our FiO2 here with our FiO2 dial, and we're going to adjust our FiO2 based on our table unless we're giving chest compressions. If we're giving chest compressions, we're going to dial this to 100%. But if we're just giving CPAP or positive pressure ventilations, we're going to adjust it based on our preductal SpO2. If we're just giving breaths, the goal is 40 to 60 breaths per minute. You want to count out loud, so you would be breathe 2, 3, breathe 2, 3, breathe 2, 3. And that's the NRP guideline for the rate that you want to deliver to that baby. Indications for positive pressure ventilation would be if the infant's heart rate is less than 100, they're apneic, or they're gasping. All right, thank you.